Acetaminophen can be used effectively, instead of morphine, to treat renal colic. Renal colic is the pain due to the kidney stones. Morphine is a classic example, which reduces the pain to a great extent, but has side effects like hypotension, respiratory depression, apnea, nausea, and vomiting. The present study was involved in comparing the effect of intravenous acetaminophen with that of intravenous morphine, with less or no side effects. The aim of the study is to analyze the effect of acetaminophen in reducing hypertension, dizziness, and renal colic. The study is a randomized controlled trial, with patients screened with the renal colic pain. The subjects were selected from Iran, and were grouped into two, with 62 each in acetaminophen and morphine group. The percentage of males in the study was 67.7%, and the mean age of the patients was 39.06%. The results were measured by using SPSS.18, chi-square, ANOVA, and regression. The pain was analyzed by using the visual analog scale ruler. The study included the patients between 15 to 80 years of age, with renal colic and who were referred to the emergency ward. According to the study criteria, the weight of the patients should be 60 to 80 kilograms with renal colic. The study excluded drug addict patients, patients who were allergic to opioids and acetaminophen, and those who had received analgesics within the previous 6 hours of the study start. Patients with kidney transplantation, heart failure, renal failure, respiratory failure, liver failure, blind, and those who cannot speak, were excluded from the study. Morphine was given intravenously, over a 15 minutes infusion period. The fast rate was avoided to prevent the release of histamine. Acetaminophen was also given at the same rate intravenously. The pain was initially assessed before the drug administration, and 30 minutes after the drug administration. The results were analyzed using SPSS, chi-square, ANOVA, and logistic regression. The results were established after the completion of the intervention. There was no significance between the mean of pain scores between the two groups before the drug use. The p-value was found to be 0.415. The pain was significantly reduced by using morphine. Acetaminophen also reduced the pain, but not as much as that of morphine. The drug's effect on patients among different age groups was not significant. That is, both morphine and acetaminophen have been effective individually. In acetaminophen group, there was no effect of the drug in the age group of 30 to 40 years. Effect of drugs on gender. Morphine showed the same effect on both males and females. In acetaminophen group, the females exhibited more pain relief than the men. But both the drugs showed the same effect comparatively. Intravenous morphine exhibited more side effects and complications than the intravenous acetaminophen. Morphine administration led to vomiting in 1 patient, arterial hypertension in 6 patients, and dizziness in 15 patients, accounting to 1.61, 6 and 15% of the morphine group population. Acetaminophen did not cause the complications in any patients, therefore the frequency and the percent of patients having vomiting, arterial hypertension, and dizziness was 0. There was a significant difference for dizziness between the drugs, with the p-value 0.000. The drugs had a significant difference for arterial hypertension, with the p-value 0.014. Morphine is effectively used to treat the renal colic, but is associated with a number of side effects. Acetaminophen, when given intravenously, can reduce the renal colic, not as effective as morphine, but the side effects associated with morphine can be overcome by replacing it with acetaminophen intravenously.